Today we will talk about how to incorporate fluoride varnish application into your primary care office. My goal is to convince you that this process is critical to improving the health of children in Indiana and that it can be implemented smoothly and profitably into a primary care office. My name is Sarah Boslett. I am a pediatrician at Witham Health Services in Lebanon, Indiana, and I'm the current president of the Indiana chapter of the American Academy of Pediatrics. I have no financial disclosures, and if you have any questions or would like to contact me, my email address is available, as you can see. Application of fluoride varnish for all children every 6 months from the eruption of the first tooth has become the standard of care recommended by the United States Preventive Services Task Force and Bright Futures. We are thrilled that as of January 2017, Indiana has become the 50th state to offer payment to physician offices for fluoride varnish application in the primary care setting. Every child should receive fluoride varnish every 3 to 6 months from the eruption of the first tooth through age 6. As we move through this oral health and fluoride varnish training, I encourage you to reference 3 resources: the United States Preventive Services Task Force Statement from 2014, the AAP Policy Statement, Fluoride Use in Caries Prevention in the Primary Care Setting, and the Bright Futures Oral Health Guide. Each is 6 to 7 pages long and reinforces much of what we will review today. Links to these articles can be found on the Indiana AAP website. So, a question that may come to mind is, why are we doing this in the primary care office and not in the dentist office? There are several reasons. First, there simply aren't enough dentists who are trained and comfortable examining children to provide fluoride to every child. Many who see kids don't actually apply varnish. Even when pediatric dentists are available, their wait times can be very long, and they may not take all insurance plans. In addition, kids in Indiana get a lot of cavities. We don't know exact rates of caries in toddlers and preschool children in Indiana because these studies are expensive. But we do know that by 3rd grade, half of Indiana children in public schools have evidence of dental decay, and that fluoride varnish preventive care can decrease this rate by 30 to 35%. We, as pediatricians, are the one location where infants and toddlers are consistently seen and can receive this service. Lastly, this is a terrific project for team implementation in your office. It engages the entire staff and will have significant lasting impact on the health of your patients. This state map highlights the location of pediatric dentist practices in Indiana as of 2014. You can see that the distribution clusters in cities and that there are large areas of the state where children do not have access to preventive oral health services by a pediatric dentist. I do want to emphasize that in areas where pediatric dental care is readily available, we need to encourage establishment of a dental home and provide fluoride varnish until that care is established. In areas of minimal or no availability of pediatric dental care, we need to triage these children and provide preventive care to everyone, while referring out the children who need specialist care by a dentist. There are 4 things that are required for cavities to develop. The first is, of course, teeth. The second is bacteria. Bacteria are commonly acquired by parents and family members licking pacifiers or sharing utensils. If parents or siblings have cavities, we can assume their mouths are colonized with these cavity-causing bacteria, and therefore the child is at increased risk of cavities. Third, the teeth need exposed to carbohydrates. Juices and pop are infamous for increasing your risk of cavities. And lastly, time. The frequency and duration of exposure to foods increases the likelihood that cavities will develop. Bottles throughout the night and sticky foods lead to more cavities because the teeth are exposed to these carbohydrates for long periods of time. We should continue efforts to disrupt this cycle by providing guidance on dietary measures to prevent cavities. Children should avoid sticky foods and candies. Examples of this include gummy vitamins, fiber gummies, fruit snacks, raisins, and candies. Infants should be weaned from falling asleep to the breast or bottle around 6 months of age. Infants should also receive breast milk or formula only to drink until 6 months of age, and plain water may be offered as well after 6 months. After the child turns 1, cow's milk and plain water should be their only drinks. Discourage things like juice, pop, flavored drinks, and iced teas. When do we use fluoride? If a child has healthy teeth like the ones you see here, fluoride varnish should be applied every 6 months. In this child, we see evidence of early caries development. Note the white changes along the gum line. You should be very excited to intervene in this case. Fluoride varnish application can help remineralize these areas of decay. These white spots are reversible with fluoride varnish intervention and good oral health guidance. When you see a patient with teeth like these, referral to a pediatric dentist is critical. Cavities have developed, as you can see brown spots along the teeth, and in this case on the right, significant decay. You should still apply fluoride varnish and then coordinate referral to your local pediatric dentist. Let's talk more now about how fluoride works. Fluoride's primary mechanism of action is topical. It stops the tooth enamel from breaking down, and it actually helps it repair and build back up the tooth enamel. In addition, it stops bacteria from converting carbohydrates to acids. Children need fluoride from 3 sources. They need it in their drinking water, if the water contains adequate fluoride. If it does not, then children need supplementation. Secondly, they need fluoride from fluoride-containing toothpaste. And third, they need fluoride varnish application every 3 to 6 months from the eruption of the first tooth until at least age 6. Toothpaste is the most recognized source of topical fluoride. Brushing teeth with fluoride-containing toothpaste is associated with a 24% reduction in decayed, missing, and filled tooth surfaces. For children under 3 years of age, a rice-sized amount of toothpaste should be used, and for children 3 to 6 years old, a pea-sized amount of fluoride-containing toothpaste should be applied. Most city water contains adequate fluoride, so in general, children should drink their home tap water. To determine if a child is getting enough fluoride through their water, they can ask their local water company to confirm the amount. If they drink well water, most health departments will provide testing. The CDC recommends 0.6 parts per million of fluoride as an adequate amount. If a child's home water supply does not contain enough fluoride, a supplement can be prescribed, either as a chewable tablet or a liquid. Keep in mind, however, that many children will be exposed to fluoride from other sources during the day, such as daycare, grandparents' homes, and restaurants. Do consider these sources before prescribing fluoride, because excess fluoride intake can lead to fluorosis or white staining of the teeth. Every child still needs fluoride varnish regardless of how much fluoride is in their drinking water. Next, we will talk about how to implement fluoride varnish application into your practice. So who can apply fluoride varnish? The physician can apply it. They can also delegate this responsibility to others in their practice, such as the nurse practitioner, physician's assistant, RN, LPN, or medical assistant. Here you can see a list of the supplies that you will need for your office. You will need some 2x2 gauze to dry the teeth off. You will need some fluoride varnish. You will need a mirror or a child toothbrush in order to examine the tooth surfaces. And you will need some gloves. In total, these supplies will cost about $5. Many offices will package these in a Ziploc bag so that at each patient encounter, they grab a kit and put it in the exam for the child who will need fluoride varnish application. 5% sodium fluoride varnish is sold by multiple vendors. You can find a list of several options on the Indiana AAP website. These fluoride varnish kits come in many different flavors. Note that some do come with a yellow tint. In general, families tend to prefer the clear fluoride option. Many vendors will send samples for you to try. We will now watch a video provided by our oral health partners in Illinois that demonstrates how to apply fluoride varnish.
This video will provide instructions on performing oral health assessments and applying fluoride varnish on young children. The first video shows a physician applying varnish in a real-life setting, followed by a more detailed overview. The provider examines the teeth using the knee-to-knee position. The caregiver lowers the head into the lap of the physician and holds the child's arms down at the child's side. The physician is examining the teeth for signs of decay, drying them with gauze, and then painting the varnish on all the tooth surfaces. The whole process only takes 20 or 30 seconds. The physician also uses this time to provide education on caring for the child's teeth and visiting a dentist. To begin, prepare the office by gathering all the supplies you will need. Supplies include gloves, gauze, a mouth mirror, and varnish. Arrange 2 chairs facing each other. Once the procedure has been explained to the caregiver, place the child using the knee-to-knee position. This technique will allow you to better examine the teeth and will calm the child since they are being held by someone they know. Have the caregiver face you and lower the child's head into your lap. Be sure to ask the parent to tuck their child's legs under their arms and hold their child's hands down at his or her side. Next, examine the teeth and look for white or brown spots and plaque on the teeth. Brown spots are cavitated smooth surface caries, and this child needs to be seen by a dentist right away for treatment. White spots are non-cavitated smooth surface caries or very early decay and may remineralize when varnish is applied. If the child's diet and oral hygiene change, these spots may improve before the next visit. Any findings should be noted in the chart and examined at the next visit. Mix the varnish and place it on the glove of the other hand. Using gauze, dry the teeth as best you can and paint the varnish on all surfaces of the teeth. Establish a pattern when you apply varnish by starting with the top teeth on one side, painting all the top teeth, and then moving to the bottom. Saliva sets the varnish, so once you are done, the child can eat or drink. Tell the parent to avoid hot foods or beverages or hard foods for at least the next 4 hours, since these foods could chip off or melt the varnish. Finally, tell the parent not to brush their child's teeth until the next day.
If you would like to access this video as you train your staff, go to the Indiana AAP website. In addition, if you would like videos for your families to watch to understand why fluoride varnish should be applied, the Minnesota Oral Health Coalition put together videos in multiple languages. This can also be accessed on our website. Currently, Indiana Medicaid will reimburse for fluoride varnish application every 6 months in children aged 0 until their 4th birthday. You should anticipate about $26 per application. Keep in mind that the supplies only cost around $5, so this can be a profitable venture for your office. Do not worry if your application overlaps with dental visits with fluoride varnish application, as the current national recommendation is for application every 3 to 6 months. Once a child is established in a dental home, you should continue to screen to ensure they are receiving fluoride varnish every 6 months and defer to the dentist to apply the varnish if the family is going regularly. If the child is high risk for cavities, consider coordinating with your dentist to provide alternating visits every 3 months for fluoride varnish application. You will want to use diagnosis code Z29.3 and CPT code 99188. This procedure can be billed independent of a well-child visit, so do apply this at every 6-month intervals until their 4th birthday. When do you need to refer to the dentist? Obviously, if a parent or child has obvious cavities or restorations, they should be seen by a dentist every 6 months. In addition, if a child has special health care needs or takes medications daily that may place them at increased risk for caries, they should be seen by the dentist as well. There are also online resources that can help you assess a child's risk of caries and help you determine when to refer to the dentist. The AAP has developed an oral health risk assessment tool that you can find online. And in addition, Smiles for Life has incorporated that tool into an app that you can use on your phone. This app does show diagnostic modules, helps with risk assessment, and shows photos of different types of dental problems that can help you in assessing your patient. I strongly encourage you to collaborate with your local dentists. Let them know that you are providing this service and talk with them about how they would like referrals to be placed and communications to be done to ensure that the child receives the best care possible in coordination between you and your local dentist. If this training has you interested in more education about oral health for both adults and children, you can access for free the Smiles for Life program, which you can see here. You can also link to this program through our Indiana AAP website. In summary, the current rate of childhood caries in Indiana is concerning. All children need fluoride varnish applied at least every 6 months from the eruption of their first tooth until care is assumed by a dentist. And if caries development is seen, especially brown spots or visible cavities, refer them to the pediatric dentist. Continue to complement fluoride varnish application with education on brushing teeth, ensuring fluoride in drinking water, and avoidance of food and drink that can increase their risk of cavities. Should you have any questions or need further information, please contact us at inaap.org. I'd like to take a moment to thank several people and organizations that were involved in the development of this program. And lastly, here are links to several references that I used in this presentation. They can provide additional resources for you as you implement fluoride varnish in your practice.